our integration with Atrium, we came up with a 100-day plan, and in that 100-day plan was for us to start an ED high utilizer program. We have already enrolled close to 50 people. We're building the relationships and really being able to identify what is it that would help them in their situation. The reason why I like Steve's story is it really makes you think about things differently, because when he was homeless, normally you would first think of, well, let's get him housing. Let's find things that he would need, such as food and shelter. But when he was asked, what is most important to you? What can we help you with today? He wanted his art supplies.
I started drawing as a child in the first grade. Of course, all kids like to draw, but I had a thing for it, so everyone knew I was going to be an artist. After my heart attack in November 2014, I was weak and, disoriented, so I went back to drawing.
His artwork actually is more than just his business. It is a means of giving him a purpose in his life.
When I'm drawing, there's nothing else that matters.
He draws beautiful pictures of Jesus and a lot of Christian type artwork, which he just gets such joy in giving to people.
It takes me out to a place to where I can put a smile on somebody's face with a drawing.
What's so hard about this high ED utilizer project is they have clinical needs, which as a hospital we're used to taking care of that, but many of them just don't have the social support.
When I got out of the hospital after my heart surgery and stuff, I didn't have anywhere to go, so I was on the street. But I had my sketch pad, so that's how I feed myself, clothe myself. I do it by drawing. Well, one day I run out of luck.
He had gone to wash his clothes and someone stole everything he had, and all he was left with was the clothes on his back.
I didn't have any more drawing paper and I was hungry. I was at Navicent Hospital and I went into the cafeteria down there where the staff are, and I got me a big plate and I fixed it. I said, well, it's now or never, He
had just gotten some food and I noticed that he went straight through without paying for it. But I also noticed that he still had an armband on where he had been one of our patients. It just hit me that he probably is one of those that we would be intervening on.
Miss Carol, she took interest in me. And so when she paid my bill at lunch, she offered me a place to draw for a day or two. She knew that was a sole idol and monarch of my heart.
In the past 3 to 4 weeks, he had already been there 7 times. And his heart failure was at a crisis because of his situation.
I was on the verge of suicide. I was done without my stuff. But Miss Carol introduced me to these people, and they just began to help me and do for me, and it was like I had been taken up into rapture.
We've been able to help Steve with getting his medications before he left the hospital, being able to help get him connected to a primary care physician, and then also with his specific heart failure, we were able to connect him to the nurse practitioner Yolanda Gates through the heart failure clinic.
We're very optimistic on Steve's outcome. It's going to take some time. We've got his blood pressure under control and his heart rate under control, 2 major components for treating heart failure. We think he's going to do very well.
It has taken the whole team to work on different pieces of his situation to get him past a big hurdle.
Have you been up on the 8th floor? That's an awesome place up there. I love them people. Yeah.
As he has made little steps toward improving, you can see just a happiness about him. He's laughing, has a sparkle to his eye, and he has really become a true artist.
The first time I saw one of his drawings, I almost teared up. It was so powerful. It was a picture of Christ with a crown, and he's promised to draw one for me.
And there's nobody that can take their place in my heart. I just love them, and I want to do better and show them that I can.
The whole Healthy Communities program and what we do with Atrium, it's just a wonderful time to be in healthcare, to know that we are able to help our community as a whole.